Winnebago County Health Department updates.
Well,
Can we do the approval of the minutes?
yeah, and we need to
Oh, I'm
bring the
sorry,
rest of the
I'm
executive team on. So hold on, let me get the rest of the executive team on so you get to see everybody now. You know,
Sandra,
yes,
would you introduce Christina to the board?
yes,
Video.
okay. Let me see who else. Okay, Lucy's got her iPad going there. Hold
I
on.
want to finish the landscape where I could see more people that way.
I have to go to do this the old fashioned way.
Rest of the team on? Yep, yeah. Yep.
I like the
So we'll
old
get-
fashioned way.
I know it's a little Brady Bunchish, right? For those of us who remember that show.
Mhm.
And as we said, we're all a little challenged on this. Some of us have to do it more than others. I know Todd Marshall was practicing.
Oops, I just put down there.
Now it's looking good now.
I don't think I'll just stay there. There we go. Might need a little too bright in this room though.
Hey, Jim. Hey, Peter. Hey, Cynthia.
Hi.
I know they probably won't be staying on the entire time because everyone has been working and, as you would guess, in incident command, but we thought you'd want to see all of us and we wanted to see all of you.
Good.
It's the proof of life moment.
Yeah.
Hey, Cheryl, good to see ya.
Oh, hi.
Now my phone's deciding Siri wants to join us now too.
What's one more?
Oops, I haven't turned it on.
Well,
Okay.
Todd and Mindy, Todd, can you get your camera on?
If they right
Come on,
click,
Todd,
they might.
get the hamster
Yeah.
running.
Mindy, you're on the phone, not on your camera. There's
I am.
No.
Finish my 2 cookies.
all right.
Jim, you look so distinguished, Jim.
I do. Well, I've never been on a Brady Bunch beginning. Here's what it looks like.
Okay, well, as long as you can hear her.
There we go.
We're trying.
All right, bye.
He says he can't get it working right.
There's Todd. Okay. Todd Marshall. Oh, we're getting everybody. Mindy.
Yeah, I was lucky. I had my 15-year-old daughter set me up, so.
We're, as the saying goes, we're learning to support each other in our new tech world, right?
She's been using it for AP classes for the last couple months, so she knows.
Now you know the struggles the kids are all going through and teachers and
A lot easier for them.
so
Yeah, they
Mindy,
can still be taught.
Mindy, you might want to disconnect your phone because you got your phone and your camera up.
Okay.
'Cause they'll get a reverb on it. Yeah. Same thing, Cheryl. You've got your phone up too. You may want to.
Hopefully she has it.
Okay, I think I got it now.
Okay. We're going to run upstairs and get Todd Marshall on.
Somebody come up.
All right, I'll be back.
It's
Ron, put your new picture up. We like your new picture.
Ron, you're not showing up.
One thing bad about being on Zoom is I got to look at myself all day. Gee.
I know. All we do is Zoom.
And Teresa, I don't.
How do you turn the video on?
Oh, you got to click it. Are you in your office, Teresa?
Yeah.
Okay, I'll be over.
I don't know. My small group Bible study did a lot better job getting on Zoom than these guys.
No, I'm amazed. Aren't you guys doing this every day?
No.
I do this. I do this 6 or 7 times a week.
Dan, are you on the video?
All we do is Zoom.
Teresa, I don't.
Yes, I'm in the session here.
Dan, it's playing on the live stream right now.
Correct.
Oh, you gotta click it. Are you in your office, Teresa?
They called the meeting to order already.
Be over.
Yeah.
I don't know. My small group Bible study did a lot better job getting on Zoom than these guys.
Now we're playing the recording in the background.
Yeah. Wow. All right. I move we adjourn.
All in favor?
No.
We forgot the finance committee.
Any time
Ron.
together in 2.5 months.
I know. Yes.
We haven't gone this far. Stop.
Oh. Teresa has to
Sandra, you're making
rearrange
us
your
busy
office.
there.
Hey, Cheryl. Thanks for dropping off the agenda and everything. You got
You're
your
still
sound
muted,
off.
Cheryl.
Allison, I love the sign on your door. You cover all aspects.
Computer audio.
Yes, I do.
There you go. You're all
I
set.
don't like any solicitations. Hey, Todd got the gerbil to move in the cage.
You got it.
Good.
I gotta turn up my volume somehow. I gotta do something here. Hold on. There.
You're doing good.
All right, there's my volume.
Yeah, we can hear you.
All right, good.
Mhm.
Okay.
Did I just hear a cat?
A cat. You
No.
never know. But not at my house.
Mine neither.
Or mine.
Not
It
here.
might be mine. I have one protesting at the door because they can't get in.
Uh-oh.
Mhm.
That's why the dog is sleeping on the floor next to me because I knew she'd come up anyway.
Quinn.
Looks like we're just about ready.
I have a question. I have 9 pictures on my screen. I don't include Ron and anyone else other than the
You have
9.
to slide,
How
well,
do
you have to slide. Are you on an iPad or a computer?
iPad?
You can slide it
If you
over.
go to the, if you go to the gallery view, you will have a picture of everybody. Take your
I have that.
cursor or whatever and go up to the right-hand corner at the top and see if there's another place that says gallery view.
Oh, participant is participating.
There's no, it just says participant.
Let's see, under more.
And then there's under more, there's chat, meeting settings, minimize set meeting,
Yeah.
virtual background, raise hand.
Yeah.
Otherwise, you can just slide it. You can slide it across the screen and get 9 at a time.
Yeah, but if you select gallery view, it'll show everybody in a little box.
It does, yeah.
Now,
And
now
then
I
it
get-
highlights whoever's
I get
speaking.
a
Like
few,
it'll like highlight the whole box, whoever's speaking, and then if other
Right.
people speak, it'll put a little line underneath.
Yeah,
them.
but on the iPad, it only does 9 at a time. So if you want to see
Yeah.
other people, you have to
Yeah.
slide.
It's a
You have
slide,
to slide
yeah.
it to the left.
It still
slid
shows the green spot, the green
I
box.
slid mine, I have 9 different faces, so I'm good.
Does everybody know this is live on YouTube right now?
Mm-hmm.
It is.
You should see all the likes we're getting.
Wow, chuckles.
So that's our Open Meetings Act, I guess, live on YouTube.
Oh, Teresa. Okay, yep, I see her. Yep.
Okay,
So
our
we would
first
need-
activity of the day.
So we have to take one step back. I'm sorry. I don't think we did. Did we do approval of the minutes?
No.
Nope.
We did
So
not.
we need a motion to approve the minutes.
Approve the
So moved.
minute.
Second,
I'll move. Second,
Second.
whatever.
all in favor?
Uh,
Aye.
Any opposed? Excellent. I don't have a president's report. So now we can move on.
I do want to remind you, though, that you will need to determine a secretary with the retirement of Dr. Lidval. We have an open position on the board for a secretary.
Wait,
Okay.
Dr. Lidwell retired?
Yes. That was in the, I want to say in the February meeting was his last meeting. So I asked him if he wanted to come on for this great event and then in March, and he was already hunkering down at that point. But we did say we would be celebrating him moving forward.
We were too much for him?
Yeah, he said he was going to his retirement, his cabin in the woods, and that was it. He was staying there. He was staying put.
Okay.
And of course, we did do some recruitment for additional board positions, but it's been kind of an interesting time frame. As you would guess, we were looking for another physician to fill the position on the board. And so I've got a couple of individuals who have stepped up, expressing interest moving forward, Dr. Williams, and I'll get those names to you for consideration for the board.
Excellent. Okay.
You need somebody to stand in as secretary until the fall. Is that what you're saying?
Well, yes, we will need that for signed minutes and things like documents going forward. So we do need an interim to stand up to.
You
I can
volunteering?
do it, Sandra.
Okay.
Thank you, Pat.
That was on camera, correct? She volunteered.
Yep.
It's also being recorded.
Excellent. All right. Can we go to health department updates?
We've had a little disease called coronavirus that has kept us pretty busy. We were taking a look at that and I want to make sure, first of all, the Board of Health is receiving what we call the daily report, which gives our kind of numbers. It's the plotting out of the epi curve, looking at some of the Restore Illinois metrics, as well as the liaison reports on Friday, which started back in January. If you can believe that, when we began to start first looking at this disease and what it might look like in our community. We have been in emergency operations pretty much since the beginning of March. I'm going to kind of point out what everyone's doing at this point. Katie O'Toole has been running what they call the Communities of Concern group. They've been doing outreach into the zip codes with high rates of disease, along with Antoine George, who is a lead on that, to identify outreach, education, and support to encourage testing within those populations. Cheryl Floyd has continued to run a modified WIC program. We've still had to do all of that we're doing kind of a touchless system. We still are not paperless in Illinois, so this is a little problem. They do quite a bit of mailing and coupons, and she has also stepped on as a liaison on the COVID-19 hotline with all the people asking questions, especially around business guidance. She's been working with Charlotte to help get those responses crafted. And everyone keeps changing, so I keep losing them, so I'm gonna have to go back through. I had my nice up the airport. Todd Marshall he was our liaison officer, and we rotated him out because, of course, as you would guess, food establishments and restaurants and bars, and as well as working through what we call the Corona Motel, which is really for housing of individuals who are isolated or quarantined for COVID-19. So he's been our liaison with the hotels and motels in that area, has been kind of in that position and filling that. Todd Kizer's been doing absolutely nothing. I just want you to all be clear. He's been doing absolutely nothing in health protection. Every day, his team stands up to receive all of the results. We have been contact tracing from the beginning, and I think a round of applause for his team, because we never have fallen down on the contact tracing, despite all the negatives that you have heard. But I think it's been a yeoman's team. He has quite a bit of Medical Reserve Corps that is both under the direction of Teresa James and her employee. But Teresa James has also been leading what we call the Locations of Concern, which is our long-term care and congregational setting task force. She, along with Chief Coral of Cherry Valley Fire, have been the ones that really have been working with our facilities that have obviously a higher rate of infection, as well as unfortunately a higher mortality rate. But they have been working to, do the enhanced guidelines, the screenings, and really work with the surveyors that are coming in from the state to best prepare that group. Cynthia Hall has been over at the Joint Information Center at the Emergency Operations Center, working to get all of the media coordinated, all the messaging that goes out from that, whether it's social media, if those of you, I know some of you are commenting on that, press releases, the twice a week. I've learned the new term pressers, and I can tell you that they feel pressure. No wonder they call them pressers, but obviously working through all of that. Mindy Idell there has been running with the group that's been doing the isolation and quarantine monitoring of our individuals at the Corona Motel, and ensuring that all of the personnel in our department, they screen them every day to make sure that they are maintaining good health status, as well as maintaining routine operations. We still have tuberculosis. We still have, STDs that need treating, and refugees that need screening and immunizations to be given. Peter's been kind of leading up with Angel Abraham, our MPH epidemiologist, working on the data modeling. So he's been leading the data modeling team. So a lot of the reports and graphs that you see are the work and the modeling and projections that we came out with, recognizing the first week and a half in May was going to be our tough week, was spot on for the modeling group. So, and of course, Jim Keeler has made sure that we have money to run, right? Making sure we have all of the contracts and agreements, keeping us running during all of that. And so it's been a team effort. And of course, Charlotte over at the state's attorney has been our, I'm going to call it legal eagle, along with Nick Myers at the city of Rockford, has been really working with all of the guidance regarding businesses and interpretation of the executive orders, as well as making sure that when we need to do an order for closure or an order for isolation or protection, that she is involved in working in that if we have to go through the court process for that. So obviously our daily activities have been significantly disrupted, as we would expect during a pandemic. But the team has really pulled together and is, I was going to say, working, unfortunately, nonstop. So I told them after this, anyone who would like to come off the call can certainly, most of them start their days very early at 7 or, earlier in the morning, getting things rolling for the next day. This has been a 24/7 operation from the beginning, from authorizing tests to now it's managing the positive test results, the contact investigations, making sure that we have people isolated and quarantined appropriately. And as you would guess, making sure that our various facilities have what they need. We have stood up 2 different testing sites through the Emergency Operations Center, one at Auburn High School, so our capacity in terms of testing, as well as the UIC College of Health Sciences. That was staffed by the National Guard, but I have to say our community has tested over 5% of its population. And that's ruling out duplicates, because I get all the time, are you sure people didn't go through 5 times? I'm like, well, okay. But Todd's group makes sure that we're not getting those duplicates. But I think we have a better understanding in our community based on a lot of other counties of what our disease prevalence is. We're running at about 13% positivity. That's a rolling positivity rate. The goal is to keep it below 20%. We still are not on the downside. We've flattened, as you can see by the epi curve that we've got going. Our growing infection rate is among the 20 to 29-year-olds and the 30 to 39-year-olds. Who are out and about, probably not doing as much social distancing, masking and all that they need to do. But also when you look at, they were part of the essential workforce. So oftentimes they were out working. So you would expect that. Our highest mortality rate is in the 80 and over group. About 2/3 of our deaths are associated with a congregate setting. And we define congregate setting, as Teresa knows, not only just to be long-term care facilities, but we have a lot of different congregate type settings, from adults with disabilities to children with disabilities to that are not, they're licensed not through the Illinois Department of Public Health. They might be licensed through Department of Human Services or Department of Children and Family Services. So with that, if any one of the team members would like to add maybe what's their most favorite thing to do while they're in COVID, or if you have questions of any of them, please feel free. No questions? No comments?
I think that the thing I get the most questions about in the community, and I'm not seeing a lot of people, but I'm talking to a lot of people on Zoom, is about what's happening in those congregate facilities. And are we testing everybody, or how are we trying to get a hold of that?
A lot of the congregate setting facilities have advised their staff to go to the drive-in not treatment centers, but the drive-in facilities to get tested. We worked very hard with the administrators of those facilities so that they didn't send all of their staff at one time, in the event that, what if you send all of your staff and then they're all positive? So they have been spacing them out and sporadically sending them. Now we're getting more and more facilities that have gotten their medical directors or their medical advisors on board to do in-house testing. So this morning I delivered 250 test kits to Forest City Rehab to do testing there. And then hopefully tomorrow morning, I'll have another 150 test kits that are going to come in for Milestone. And then Milestone is going to do their residents and their staff as well. So they're starting, and then there's a few facilities, very few actually, that qualified for a direct shipment from the state for the test kits directly. And one of those was Park Strathmore. They've tested everybody in their facility, and they're maintaining no cases there.
So everyone, yeah. I know someone's got a phone, I think, going on. Someone, but just to kind of,
Okay.
those were probably one of, when they first started up, Pat, the issue was, first of all, we had staff. Now, all the staff are screened. So anyone who is sick is taken off of the work line. So if they have a temperature, if they exhibit signs and symptoms of COVID-19. And so now the screening is really related to the asymptomatic transmission, recognizing that that is probably occurring in that work environment. And, you know, initially nursing homes and long-term care facilities, you know, those would have been our traditional term for them. They're not set up for the level of care that they're being asked to supply in terms of personal protective equipment. I mean, the supply chain is just catching up on, as we know, with N95 masks. Typically in some of those staffs, and Teresa can, you know, and Joe, that was part of their assessment, was maybe one person was fit tested to wear an N95 if they were lucky in those settings. So most of it was, you know, again, procedure masks. A lot of it's what I call very close distance care. They're not going to be able to maintain 6 feet of isolation or separation from anybody. They're feeding people, they're changing people. They are oftentimes, you know, having to suction and things like that in those environments. And of course, one of the things that we recognized early and was the fact that we needed to help also provide, I think one of the things that Teresa did not share is they stood up a mental health care team to go into those facilities with them, recognizing that we needed those workers to continue as much as possible on the front line safely, recognizing that they felt like they were under fire for being blamed for the infection rates, that they were losing people that they cared for. Many of them, you know, go into long-term care. These are their families. River Bluff calls them their neighborhoods. That's not uncommon. And so you can imagine how hard it was to work under and continue to work under these conditions where people are dying, family members, they're not allowed visitors in. So, you know, these are very much closed sections. So keeping them working under these kinds of conditions became very important. And I think that, you know, while it's not perfect, we'd like to lose nobody in those settings. We certainly have watched those infection rates and really kind of proactively reached out to them. And now the state as well has a team. And so we kind of work in hand. They let us know. It always seems like it's on Saturday morning, right, Teresa?
Yeah, unfortunately, yeah.
We get the notice that they're going to go into one of our facilities, including River Bluff, which is one of our facilities at the county. I mean, and when we talk about testing staff, remember, if you thought that 20% of your staff may test positive, that meant you'd have to replace them. And so what replacement staff did you have available in terms of nursing commercial registries and things like that? So that's when Teresa talks about phased in testing. It's not to allow people to work that are sick because we're already removing those folks. But if you have that level of disease activity potentially in your staff, you may not have sufficient staffing to maintain it. And there were some concerns early on, and, you know, again, always a fragile system of that we may not have sufficient staffing in these to care for individuals, and they would have to either evacuate those skilled facilities. And there were scenarios in California and New Jersey where people walked off the, you know, they didn't have enough staff walking in on the job. And so, you know, we had to be very careful in a very difficult situation to navigate the importance of that. And we understand family members are devastated. They cannot talk to their loved ones. They can't. They're, you know, but every nursing home is attempting in some way, including Skype and, you know, and things like this, to stay connected. They call them window visits. We have to kind of discourage that sometimes because people go into other people's windows, which, you know, we have to be thoughtful about that. But trying to be creative about how do you help people stay connected. So I really, that's been a kudo group that, you know, has been really working hard. I also challenge you to look on social media about our communities of concern. And Katie, maybe you could unmask for a minute and talk a little bit more about communities of concern. We're all in our offices. So.
Yes, well, but we normalize wearing a mask, and I've noticed this whole time I was comfortable wearing it. So everyone can wear their mask. Wear your mask when you go outside, and especially when you're less than 6 feet from others. The Communities of Concern team has been working hard to try to reach those zip codes with the highest number of COVID-19 per resident in the area. So we've really been focusing on getting out messaging that's different than the normal messaging that's going out through the Joint Information Center to kind of identify messages in a different way. So one of the things they did, as I can show it, is we made a card, and then we made it so it'd be more identifiable, kind of more on the front, not so much with our logo or government look, but kind of really want to be noticed by the community, to kind of take another look at it, look a little closer in a different way. So Antoine George kind of came up with the design for the cell phone. And so this is with prevention information on the front, resources on the back. We went out into the community and did some canvassing door to door into those zip codes that were the communities of concern most hit. So the team got some volunteers, our MRC volunteers came out, they were highlighted in one of the news briefings that took place, to get out into the community and really to also let the communities know that we're here for them, we care for them, there's resources available, we want to make sure they have those resources and make sure that they're connected and to those communities. And some of the other activities that they're doing is the Y815 Mass Up campaign. So that's in coordination with the Joint Information Center, taking images of the community, members of the community with the mask and their statements of why it's important for them to wear their mask. So they're going out on social media. We know that they're being shared widely. We've seen quite a lot of analytics on that, over 7,000, a reach of over 7,000 for the Facebook post of the first one and over 10,000 for the second one. And then we sent out another one on Monday as well, that I don't have the statistics on how far that reach was yet. So that reach has been going out far. They're also kind of trying to make inroads 20 to 29-year-olds with influencers of that age group on kind of how to not do mass gatherings, and how to kind of encourage them to stay apart. And another thing they're working on is we've gotten donations. We'll have over 1,000 masks that were donated to try to get out into the community of concern for those people that really need it. So kind of through our food pantries and other distribution methods that we're setting up. Our key projects right now.
Well, I just want to say, Sandra and your staff have done an outstanding job throughout this whole ordeal. No question about that.
Thank you. They've really, it is rolled out.
Yeah, really. I say you've tested positive, or people have tested positive, nearly 1,600. I just wondered what are your stats, how they compare with counties of similar populations.
Well, right. Yeah, Illinois is one of the higher testing states. I mean, I think that was a proactive stance from the governor. And, you know, when you looked at some of the modeling, and Dr. Williams, you know, we've looked at some of this, the idea was you needed to test at least 5% of your population to understand what the prevalence, right? Because the estimates were that about 20% of your population might be infected. And if you looked at the earlier models about even conserving hospital space, and bed capacity, was that if 20% of the population required hospitalization, would you have the capacity? And so the idea was to keep that infection rate lower. So as we learn more about as more people test. Now, the test is not 100%. So we should all be clear about this. You know, all the testing that methods that we use currently have their limitations, but I think our community did get the message, and we did. And canvassing, I got to go out with the group, and it was people would, you know, it was kind of interesting. You'd stop, maybe knock, and then walk down a few stores, right? And then they'd come out and say, "Can I ask you some questions?" They knew, I have to say, they knew the difference. They wanted to know if it was the nasopharyngeal or the nasal swab. And they wanted to know, and a lot of them were saying, you know, trying to do the best they could, you know, to stay put. We talked about how to have a safer Mother's Day, because we knew that was a big holiday. And also as the warmer weather, you know, shared barbecuing, kickbacks, they were calling it, you know, and again, learning a little bit different, edgier kind of thing in that communities of concern recognizing that we had higher rates and concerns among our minority populations, and again, disproportionately impacted. I get a lot of questions about why there's so many unknown. The data always lags because we have interviewed people, but it takes a while to enter all the information once we do the interview about race and ethnicity. So that's constantly along with date of illness onset. So what you typically is the most current is the number of positive tests, and then everything else kind of lags until we can complete the interviews and enter all of that data. So it gives a more complete picture.
Okay, thank you.
Anything else about COVID you wanted to ask, but we're afraid to ask? All right. The other thing that we've kind of been really working through, and I'm going to let Peter take this on, is we have not let our Community Health Collaborative and our process in completing the Community Health Assessment, Community Health Improvement Plan, that was one of the things we maintained on timeline to continue moving forward because we were contingent on a collaborative. So Peter, maybe you want to give an update on that?
Sure, happy to do so. So we have the 4 MAP assessments that we've talked about with you before. The Force of Change, Local Public Health System Assessment, the Community Health Status, which is sort of the big data book, and then the Community Themes and Strengths Survey process. All 4 of those assessments are kind of wrapping up, winding down. Final reports are being drafted, and some of those have been shared with our partner steering committee so far. And over the next couple of weeks, those should get pulled into sort of final form. And that really sort of completes the first part of the map of the whole process. And then we're going to move, taking the COVID situation into consideration, we're trying to figure out how to use this technology to move into the next phase, which will really be, coming out of all these separate assessments. What are the common themes? What are the key issues that come out of that? How do we pull all that information together and synthesize that? And how do the various partner organizations look at that? How do we look at that collaboratively? And then also how do we, how will each of those agencies also work with that information? So that'll really, so we're going to be winding down the first phase of this really end of May, early June. We'll have those reports and those will be completed. And then really this summer, we'll move into that next stage of figuring out how do we go from, okay, now we have all this data, how do we use it? And how do we use it to, are there new issues that arise after the last cycle of doing these? Have things improved? Have they gotten worse? Are there new issues that have arisen? And so that's really kind of where we are with all of that right now. So there's a small working group, the sort of governance backbone group, which is the Regional Health Council and R1 and Transform Rockford and the Health Department. And we sort of work among ourselves and then work with the larger partner steering committee, which has all the health systems and other agencies like United Way and others who are part of that larger partner collaborative. And so we're working our way through all those pieces now. Any questions? We've sort of been trying to keep this going while, as Dr. Martell said, while everybody's so involved with everything else that's really critical to the immediate health of the community, we're trying to keep these processes moving with sort of a longer term eye towards what comes from as we come down the pike. And certainly, as we talked about communities of concern, where we see the high case rates, that's where we also see issues relative to health disparities. And that certainly is something that dovetails with what we see in the other data about the health status in the community and things like that.
Mm-hmm.
Any questions for Peter and any suggestions you've seen on, this is going to be a challenge as you would guess, because group gathering sizes don't look like they're going to progress to more than 10 for a while. So I don't want to set anyone up that, tomorrow, I keep hearing that Rockford's coming out June 1st. That's not exactly the case or the truth. There are some modified, priorities, but again, taking a look at how do we effectively engage people in the prioritization process? How do we help them understand what, even before COVID, or how do we coexist with COVID? What are we going to be living with beyond a pandemic, right? What other health factors will continue to persist or be amplified? I think that will be another kind of, we've certainly seen some amplification on system weaknesses in healthcare. We've seen some issues around health, equity and health disparity concerns, economic, differences, how disruptive this is for all kinds of supply chain. So it'll be interesting to see how those all inform then how people prioritize moving forward. So we've kept that going, and Peter's been instrumental in keeping that going. And of course, I'm going to turn it over now to Todd Marshall, who can't wait to post food scores, given a pandemic.
Right. Good evening, everybody. Yes, regarding the posting of the violations, the scores and all that, the Illinois Department of Public Health has ruled that out through the FDA to not provide scores. So we did a quality improvement project about this about 2 years ago. And I know we were going to roll it out at that time, but if everybody recalls, it was when we adopted the FDA code, we felt that it wasn't proper at that time to give them a chance because there was new codes and everything like that. It was a complete rehaul of the food code regarding the FDA. So we held off on it. I'd say 2 months ago that we did take it to the policy committee, and I did do a demonstration of this to show how easy it can be for the public to look up people's violations. It would basically be a tab that you click on. And basically what the tab would do, the first set of it would be some instructions. And what I mean by that, it would basically tell what kind of risks their facilities are. It kind of explains what kind of inspections we do, routines or rechecks, and also the type of violations, if they're a priority or they're core violations. So it really gives that holistic approach of how to understand these violations. And then you can click for it. You can do it for multiple years. You do see the violation and you do see the code number behind it. So you can reference it to the code through our ordinances. But obviously we'd like to roll this out, but obviously with the pandemic going on, and the big picture is we did another quality improvement with foods. And that was really to working with the workflow regarding facilities rebuilding their kitchens. So there's a lot of information we'd like to get out, and this could be part of it at that time. But just to let you know, we have been talking to the food operators and owners about this for years. They know it's coming. So, okay.
And Todd really has been leading up a group. I mean, obviously now we have to be sensitive to the fact that many of them have not been in full operation. If some have chosen not to do curbside. And so one of the things that Todd's group has continued to do is work with them, as well as all of the food distribution plans for the schools that had to feed the children over, the pickup, I think the amount of mass organization and planning. So they kind of diverted on that. So we're going to have to be sensitive as to when we reintroduce a posting of a food score, as you would guess, because one of the areas that obviously when you hear about what plans for Rockford are, one of the areas is in this kind of 3 was to look at, could they begin to do some table service? And Todd's been kind of working them through what that would take, what's that going to look like in the new pandemic era. And it's how things would be very different, whether it's reservations, no menus, the fact that your wait staff may be masked, and what kinds of equipment, knowing who's in the restaurant at any given time, that it's a different world now on that. And how do you, as well as their supply chains being disrupted, as you've heard about some of the shortages and some of the commodities and things like that. So we're really kind of focusing now on how to bring them back online. And, how do they kind of do a self-assessment? Some of them have not operated their coolers, they've cleaned things out right before, as things close down. And how do we bring them safely back online in a way that they don't, that does not jeopardize them moving forward? And so I think that's kind of been the refocus, even on posting on food scores, recognizing that we're probably having to kind of reshift and refocus on that. And I guess the positive side, and the two Todds can respond, is that the groups seem to be doing well. We have not had reported I'm afraid about wood now, but foodborne illness outbreak has, been low.
Correct.
That's because all the ptomaine is taking place at home.
I know. I looked at a can. I thought, is this okay? Oh, well. Just heat it to a high temperature. But I think that, again, it's been a reshift and refocus on the food staff. And hopefully we can get back to some of that. But there will be obviously some changes and modifications that they'll be working on even as they look at coming back online.
Thank you.
Excellent. And then the committee reports, executive committee. If nothing there, we can always go to our favorite committee report, which would be finance.
And you have 2 months worth of finance, so settle in and get comfy. All right, let's see. I gotta get my stuff situated here.
Please start with a page number.
Okay. This would be, well, it's not numbered, but we're gonna go to the resolutions. It's right after the agenda, the minutes in the packet.
Page 12.
You need approval of your minutes?
Yes.
Hey, I haven't got that far yet.
Okay.
All right, so first, we're gonna do an approval of the March 11th Finance Committee meeting. Way back in March. Is there a motion to approve the minutes?
The minutes in my packet say February.
No, it says March 11th on this sheet right here.
Okay.
Page 9.
Mine are not numbered,
No.
so I can't tell you page numbers. I'm sorry.
It's the second set of minutes in the packet.
The February minutes in the packet are the actual, I believe, Board of
meeting.
Health meeting. The March 11th minutes are from the Finance Committee.
The Finance Committee, yeah.
Got it.
Is that what we're looking at?
Yeah, we're looking at the
Finance
meeting on March 11th.
Okay.
So do we have a motion?
Yeah, so moved.
Is there a second?
Second.
Okay, any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, the minutes are approved. All right. Now we're gonna go to the resolution of the expenditures occurred for the health fund. We're gonna do 2 months in a row. The first month we have is February of this year. The expenditures are in the amount of $705,684.31.
So moved.
Be approved.
Is there a second?
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay. The February expenditures are approved. Next, if you flip that page over, we have the expenditures for the month of March of 2020. The expenditures for that month are $660,769.23.
Move to approve.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay. The February and March expenditures have been approved. The next page in the packet is the statement of fund balance. Through the disbursements and the revenues of March 31st, 2020. We have an ending balance of $9,593,053.37. That's an increase of $20,493.39. Does anybody have any questions on that?
Nope.
If you flip over, you have the next, the February 2020 financial review. This is for month 5 of the county fiscal year and month 8 of the state of Illinois fiscal year. The year-to-date revenues budgeted was $4,890,685.83. The actual was $2,857,512.83 with a variance of $2,033,173. The expenses were budgeted at $4,892,973.33, and the actual and encumbered number was $3,104,380.49, with a variance of $1,788,593. Does anybody have any questions on that? Okay, if you go to the next page, we have the financial review for March 31st. That's month 5 of the county fiscal year and month 8 of the state fiscal year. Year-to-date revenues budgeted at $4,893,000. Is that correct?
$4,890,000.
Sorry, $4,890,685.83. But that number is the same as February.
Jim, I think you've got you need to take a look at those on your statement.
Okay.
Because
Yeah.
one of them, it looks like the March and February, you've got fun.
The
Yeah.
budget's the same on both the revenue and the expenses.
Yeah, but the actual is different by like a $2 million increase.
Yeah.
Yeah, I'll have to put forth a new one on that.
Yeah, and the dates are wrong. They're both the 5th of the 5th.
Yeah.
Yeah.
5th and the 8th.
Yeah. So we gotta go to the 6th and the 9th. Okay. So you can just send us new ones of those when you get it updated.
Yeah, sorry about that.
Hey, no problems. We got a lot going on.
Yeah.
Okay. Is everybody good? We'll just get an updated one emailed to us in February and we will review March. Okay. Then if you go to the next pages, we have the balance sheet. For February and one for March. Jim, is there anything that you would like to point out on those?
From February to March we had revenues of 1.6 million, which were, kind of an outlier. That's because in March, which is the end of the second quarter, we had revenues for real estate taxes of $645,000. And then as part of our ongoing audit recommendations with Baker Tilly, will accrue revenues every quarter to approximate action. So that's why such a big variance, a big change in revenues for March.
Is because of the accrual that they're starting?
Yes. We recognize, every 3 months, we're recognizing roughly $645,000 on real estate tax revenues, and then an additional $333,000 in accrued revenues from delayed billing we'll get to collect. If you'll notice on the balance sheet.
The one that says due from grantors?
Yes. So that increased by $333,000 for various programs where we've not yet been paid, but they're expecting payment, so.
So they're accruing these two items by quarter?
Yes.
Got it. Anybody have any questions, comments, or concerns on their balance sheet for February or March? Okay.
Jim, did you want to give an update too from the grant? Obviously, there's concerns about grant revenues coming in as part of the corona response. So maybe you can just give a high level that they're.
Yeah, essentially, our largest program WIC is kind of been modified, but we're still running. There hasn't been much of a financial impact. We're doing all the nutrition counseling, via teleconference, and then they're delivering the benefits that they're due through certified mail. So we still are running, as pretty much per usual fiscally from a fiscal standpoint for WIC. And the same with Ryan White. We completed our last contract, and now we're with our new contract under the project of the Quad Cities. So those two programs, the two largest ones, have not really been affected at all from a fiscal standpoint. Also, the HUD program that we have we have contracts out there today, and we're kind of stymied with some of the lead abatement projects that they want to do, but they're ready to go, and they'll just be kind of a stall in our performance, but there shouldn't be an issue as far as fulfilling the obligations underneath that grant either. Then we did get a special COVID-19 crisis grant that from IDPH, which also was $100,000. We already received that money in the beginning of May, and we can easily justify the expenses on that, and they're pretty much cover a number of our fixed expenses that we would have incurred anyway. So I've got a lot of people here working very hard, and to kind of put it in perspective of, we're of an automobile, we are running warm, but we certainly aren't burning oil, and we're not leaking oil. So I don't expect any substantial fiscal hit the way things look right now. So also in a number of our programs, like in the state opioid response, we are permitted to staff that, even though our people might be working on COVID-19 crisis issues. We're still allowed to put expenses toward that. So with our local health protection grant and a number of our other smaller programs too, like the tobacco-free communities. So a number of these things do work in our favor, and we're also doing line item adjustments so that we can be reimbursed for the expenses were incurred underneath all these different grants. So the status now is that we just stay alert and stay nimble and work our way through this.
Yeah, I think that was the state moved a lot of their funding from the Department of Human Services, Department of Public Health. They allowed us to use and retain staff on those grants, knowing that they were in the COVID response. Again, moving forward, and kudos to our WIC program, because we're one of the few that continue to maintain services throughout.
Okay. Anybody have any questions before we move on?
Nope.
Okay. Next we have the bank reconciliations. Everything looks pretty standard there. Does anybody have any questions on those? Okay. Okay. Then if we flip through past the bank recs, we get to the balance sheet. Is everybody on the balance sheet area? Okay.
What's the page number?
Mine aren't numbered, so I can't tell you that. Sorry.
Sorry.
It's 46 of 197 if you're on the electronic.
Thank you. I am.
Jim, anything on the balance sheets that you would like to point out? A lot of that is,
No,
same.
I kind of pointed it out earlier that we had number of increased revenues for March as opposed to
We have then the emergency reserve minimum graph through March. We're still way above our line, just in about 7.5 million. And that's ahead of where we were last year at this time. Any questions?
What do you contribute that to? Jamie, what do you contribute that to?
Jim, you'd have to give us the thought process behind that.
I think the hard work from some of our programs, we've been trying to keep up to date with our reimbursement reports, and then, utilize, all the different things that the grants give us. So it's, when we design the budgets that we put forth, I try, to make sure they're expenditures that we're pretty certain we're going to incur in the operations of these grants, and then to make sure that we fulfill our obligations so that we're not sending money back. And then if we need to make changes, I've been meeting with the directors, potentially monthly or every other month, and try to make sure that if we have to make amendments, that we go ahead and line item changes that we do, and that we're in touch with our various program managers, and that's how we've been working it. So.
Okay, thanks.
And I think we're going to have to be very cautious, because you would guess that our tax revenue base, we would expect to be impacted pretty heavily as we move through this. We know that, there's been already some, either delays and or thoughts on what the property values might look like after this. So again, we did not expect to get some pandemic funding, which we received, that help offset some of the cost associated with. And most of our hourly staff we have kept just for reserve point. We've not used a lot of overtime at this point, recognizing that this is a marathon, not a sprint. So I think looking over the long haul, being able to make sure that we can sustain this, that's been kind of our discussion. And we did hold off on the salary increase, the cost of living in April, just because we weren't, at the time we were starting to look at, we weren't sure where we were going to be and what funding is going to be coming in. And again, a lot of this federal funding is, one time look at, it's meant for an injection or infusion. So like when we're housing people, we're having to pay for that kind of housing, or if we need to transport something, it's been some odd expenses. We went out on the market for PPE early to try and get some of those supplies. Like the infrared thermometers and all of that, you need to, all of a sudden became an item on market value, and just making sure. And of course, we're going to probably be preparing for the vaccine phase at some point. So that'll be a good thing. So we'll probably continue to watch that. And as we move forward, build that in again, back in, so that we can sustain and maintain all of the staff we currently have on board.
Sandra, that was my question about looking at the reserve. I can bring it up now. Because multiple companies are working on it, a vaccine is to come up. We do purchase vaccine for influenza. Will we think that the government will purchase or provide the vaccine as like a national health response, such as a smallpox situation?
This has been very interesting federal response, as you're aware. The state had to go onto the market themselves. And I know the county spent about $600,000 to date on personal protective equipment, from the Emergency Operations Center. So there are things that are built in here, as we go through, that we're going to have to be cautious of. Will they require us to do some of that purchasing in the open market, like we did on the PPE and some of the ventilator equipment that we were asked to There's also a switch right now. Testing is at no charge, right? We have the 2 drive-in, it's all being funded, but there was some discussion today on a call Todd and I were on about whether or not that will move to some kind of fee-based testing, and health departments having to go out and bid in the market for that. I know it's complicated at best, but again, making sure we had, we've been able to weather. So if, for instance, I mean, we've been fortunate, grants have paid and they have released the cash, and the state did not hold on to the cash during this, right? Because they could have withheld that as well, and then we would have had to float 90 days of operating at least. But they seem to have been able to maintain that, and there might be some quick infusion of federal dollars coming in for contact tracing, but it will be probably one of those things where we'll have a sudden flash and we'll have to ramp up quickly, use it quickly, and then it will go away, unfortunately, just as quickly. So we're going to have to watch that going forward, and what that looks like. But we've had to, for instance, some of the expenses you'll see coming up that were major expenditures, like the printing of the materials. We've talked about one of the other things we had to do was we purchased disposable cell phones for a lot of the staff, the Medical Reserve Corps and the court reporter staff that's working with us on contact tracing right now. So they could call from home, like they were working from home. We set up secure file. Dan, thanks to Dan over there, he can wave up to us now and then. IT got that set up so we could send records, and our court administrative staff has been helping to call people. So, again, we didn't want them to have to use a personal cell where someone would call back on. So really taking a look at how do we move forward. And there will be some technology investments when you look at some of the programs the state wants to run on contact tracing that we'll have to start spending up for, but we definitely will be taking a look at how do we position ourselves to make sure that our staff are, compensated, that we move forward. We're also going to have the minimum wage act coming through on some of our, staff level coming in. So hopefully as we prepare the budget for 2021, Jim and I are already in that session and discussion right now.
Okay, I just know the reserves looks great now, but I know there's some potentially large expenses coming down the road very quickly.
Yeah.
Speaking of expenses, the next item says coronavirus expenditures. Is there a list for that?
No list. We have a special object code that we put through for different expenditures related to COVID-19, like these telephones, thermometers, disposable thermometers, hotel expenses for some of our people that are in quarantine. So we are documenting those for potential reimbursement from FEMA grant.
So it's more of just an FYI that we created a GL code just for the coronavirus expenditures.
Yeah, and we're also doing time and effort to that as well. So
cool. All right. Well, then let's dig into the major expenditure requests. First, we have personal health services and vital records to the IDPH. This is for the electronic filing fee death certificates for February of 2020. The amount is $7,168.
Move to approve.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay. Next, we have the IDPH electronic filing fee for the death certificates of March 2020 in the amount of $8,064.
No move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, we have the IDPH, the electronic filing fee for death certificates for April of 2020. The amount is $8,028.
Move acceptance. Second.
Any discussion? All in favor?
Aye.
Aye.
Opposed? Okay, we have the health protection, Ryan White. for the pool administrators. It's for the Ryan White Part B medical and dental services in the amount of $11,268.95.
So move.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Okay, Health Administration to Time Clock Plus LLC for the upgrade equipment for the new cloud-based system. It's in the amount of $4,472.
So move.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Okay, the Health Administration is paying Service Express annual billing for the annual membership dues in the amount of $4,464.
So
So
moved.
moved. Second.
Any discussion? All in favor?
Aye.
Any opposed? Okay. Next, we have the Personal Health Services and Family Planning to Pat Brandon, APM. This is for contractual professional services in the amount of $3,460.
Move to approve.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Next, we have the Health Administration to Meridian for the COVID-19 handouts in the amount of $4,500.
Move to approve.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Okay. Next, we have Health Promotion and Wellness to Adapt Pharma for the Narcan nasal spray in the amount of $50,400.
So move.
Second.
Any discussion? All in favor?
Aye.
Opposed? And last but not least, we have the Environmental Health to Clark for the mosquito larvicide for the amount of $11,286.
So move.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Okay. So that's all done. Okay. Now we're on to the proposed contracts and agreements. Personal Health Services to the University of Illinois College of Pharmacy for faculty and staff participation in the pandemic. There's no dollar amount associated with this.
Move accepted.
Is there a second?
Second.
Any discussion? All in favor?
Aye. Aye.
Any opposed? Personal Health Services to the Village Inn Motel. It's alternative housing for COVID-19. There's no dollar amount associated with this.
Move acceptance. Second.
Any discussion? All in favor?
Aye. Aye.
Opposed? Okay, we have the Health Promotion and Wellness to Children's Home and Aid for teen pregnancy prevention. And again, there's no dollar amount associated.
Move acceptance.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Health Promotion and Wellness to KFAX, again for a teen pregnancy prevention, no dollar amount associated.
Move acceptance.
Second.
Any discussion? All in favor?
Aye.
Any opposed? We have the Health Promotion and Wellness to Youth Services Network for the teen pregnancy prevention. No dollar amount is associated.
Move acceptance.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Health Promotion and Wellness to the YMCA of the Rock River Valley for teen pregnancy prevention. No dollar amount is associated.
Move acceptance.
Second.
Any discussion? All in favor?
Aye. Aye.
Any opposed? Okay, we have health promotion and wellness to the Rockford Public School District 205 for teen pregnancy prevention. No dollar amount is associated.
Move to
Move.
approve.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay. We have EHW for ARC Environmental for lead mitigation. No dollar amount is associated.
So move.
Is there a second?
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? EHW for tailor-made carpentry for lead mitigation. No dollar amount is associated.
So move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Next, we have Gerke Enterprises for lead mitigation. No dollar amount is associated.
So move.
Second.
Any discussion?
Yeah,
All in favor?
actually,
Oh,
I do have a question. Isn't there typically a dollar amount associated with these?
Yes, sir.
You know,
Yeah, there is. There is in there. I just realized you guys said there's no dollar amount. Yeah, there is. There's $250,000.
that's what I-
Then,
Not
then
sure
we
what-
don't have the right things here.
Yeah, you don't have the right documents in there, Don. So should we put a dollar amount in, and what is the dollar amount for each of them, Todd? Are they all $250,000?
Yeah, 250,000.
It's not to exceed 250,000.
Yeah, you're right, Charlotte.
Okay, because it didn't have a major expenditure on it.
Okay, do we need to go back?
Yes, we should go
Yes.
back to ARC Environmental.
okay, so
Okay.
each one is not to exceed 250,000 or cumulative.
No, each. If I remember correctly, Todd.
Yep, it's each contractor.
Thank you.
All right, so then
And
let's
is-
go back.
and
Let's
is
go back
each-
to ARC Environmental
Yeah.
for the lead mitigation, not to exceed 250,000.
Are each of these on budget?
Yes,
Yes.
on the HUD
Yes.
budget.
Okay, thank you.
Yeah.
Okay. Move approval then.
Second.
Second.
Any further discussion? All in favor?
Aye.
Aye.
Any opposed? All right, then the tailor-made carpentry for the lead mitigation not to exceed 250,000.
So move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Opposed? Okay, Gerke Enterprises for the lead mitigation. This is not to exceed 250,000.
So move.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Okay, this is for Steen's Contractors for lead mitigation not to exceed 250,000.
So move.
Second.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? CMM Environmental for lead mitigation not to exceed 250,000.
So move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, we have Stevenson County for lead mitigation not to exceed 250,000.
Todd,
This
that's
is
not,
actually,
no,
Hello?
That can't be right.
no,
No,
Todd,
no,
that's
30,000.
That's 30,000.
30,000.
And the next one is 20,000, just so you have that.
Okay.
So
Okay,
30,000 for
let's do this.
Stevenson County.
So Stevenson County for lead mitigation not to exceed $30,000.
Okay. I move approval.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, Boone County for lead mitigation not to exceed $20,000.
Okay.
So move.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, so that covers,
I have a question before we proceed.
Yeah.
Do we have the correct, are there no amounts associated with the teen pregnancy prevention in the previous 5 or 6, as well as the alternative housing? Or do we need to check that?
So the teen pregnancy prevention, the RPS and the Y have no dollar amounts. The remainders are not to exceed 3,000.
RPS, so Rockford School District is not to exceed 3,000?
Rockford School District has no dollar amount, and the Y has no dollar amount, but KFACT and Youth Services Network,
And what about Children's Home and Aid?
same, not to exceed
Not to exceed 3,000?
So let's go back and take those.
Yeah.
Those.
All right. So we have Children's Home and Aid for teen pregnancy prevention not to exceed 3,000.
So moved.
Second.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? KFAC teen pregnancy prevention not to exceed 3,000.
So moved.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, and then Youth Services Network is teen pregnancy prevention not to exceed 3,000.
So moved.
Second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, now
Yeah.
just to confirm, does the UIC or the Village in Hotel have any dollars?
No, UIC has no dollars associated with it. What you're going to see is each time we will put a requisition in against what you have is the agreement with Village and Motel to, and then as we go through it, we will then identify it by client because that's part of the FEMA piece that we have to submit against. So for every client that's housed, we will submit a purchasing rec if it exceeds $3,000. And again, we probably at this point will be able next month to give a total estimate on that agreement. Because again, it was put together, first of all, that they would charge us the standard rate, and again, we're learning how many people might need it or not need it.
All right. So then the contract, so then now we're down to number 5. There's no budget amendments. The cost of living adjustment update.
And I gave that kind of holding on that. We're kind of really seeing where everything was coming in because at the time that this hit, we were supposed to go into effect April 1st. And we said we would, remember at our March Finance Committee, we had that discussion. COVID was just kind of ramping up and we said we would take a look at our finances and move forward. We're also going to have to take a look at our projections. And Jim, do you have any updates on that?
I think as far as I can tell, most of our revenue sources are not injured, right? With the flexibility of some of these grants, and I haven't seen anything out there that changes the position that I have here on March 11th.
So I think we are planning to, then we would implement going retro to April 1 as, and then again, budgeting in the next fiscal at the rate of with the 3% on the COLA.
Okay, is everybody comfortable with that? Anybody have any questions, comments, or concerns?
So if we go retro, that means the next pay period, the next paycheck, they get their 3% or?
It's the first full pay period. And then of course, then Jim does a calculation back, finance department back to April 1.
Okay, I was just making sure so they will catch up. Okay.
All right, on to number 7, grant awards received through April 30th. We have the IDPH COVID-19 crisis grant for 2020 from March 16th of 20 to March 15th of 2021. It is in the amount of $142,806.
So moved.
Second.
Any discussion? All in favor?
Aye.
Any opposed? And then we're waiting on the public assistance program one to get an amount.
Yeah, it's still undetermined at this point.
So we hold off on that till we get the amount.
Yeah, they have they show a minimum and no maximum, and it's, they have the detail 75% Fed and 25%.
Okay, so we'll get an update next month.
What's the minimum, Jim?
Yeah.
What is the minimum?
The minimum is $3,300.
It's fairly minimum.
But that depends on the grantee and how many awards that they have. So I don't think they finished all the accounting for all that.
Okay, anybody have any questions on the grants? All right, otherwise we're gonna move on to number 8, accounts receivable through April 30th. Jim, is there anything that you would like to point out on this?
No, we're just trying to be very diligent as far as, getting our reimbursements in, because, some of the payments are slow, and some of the contracts were actually settled late, but we're doing the best we can and all.
Okay, does anybody have any questions on the receivables list? Okay, number 9, policies to be provided at meeting. It says subrecipient monitoring corrective action plan to audit by Illinois Department of Human Services.
I don't have any, we're supposed to, with the Department of Human Services, by the end of June, have a corrective action plan and policies for sub-recipient monitoring. I've had some outlines drafted, but I don't have the full draft as far as for a meeting today.
Okay. We'll just get an update if we need to do something about those before the next meeting.
Well, yeah, Jim,
Or will they come to committee?
they have to get out. Remember, that was part of the discussion. Remember, we asked for an extension on that correction because it came to Dr. Williams and I.
Correct. So I thought we got the extension.
We did.
Okay, so when is the new date again? I don't have the email up.
Hold on, I'll get it. And again, it was, and we've really reduced the number of TP, of subrecipients now. We'll just have the teen pregnancy grants that we'll have to required to be monitoring. So if you want to move on, and I'll look it up on them. I've got multiple windows open.
We have the number 10, the audits and responses, the Illinois Department of Human Services. Is this in addition to the sub-recipient one or the same?
I believe that is the same one.
The same one?
Our extension date is through June 30th.
Thanks.
Okay, thank you. Okay, so number 10 is just a duplicate.
Yes, I believe so.
Okay.
Yeah, it was to notify everyone that we had applied for the extension. We had met all the other conditions, but they wanted to see the subrecipient monitoring policies.
Perfect.
And,
okay.
And with the extension, we should have another meeting and be able to approve those before the deadline.
Yes, because we're going to be having, we're going to start the month of June on our weekly finance committee meetings as we do the budget prep, and so we can bring that in as well. So for those of you who are on finance committee, we have lots to look forward to. It's hard to believe June is just a couple weeks away.
All right, well then that concludes the finance portion of your program this evening.
Thank you. That was a lot, Jamie, I admit.
Thanks, appreciate it.
I was like the whole packet.
Policy committee.
Well, we didn't have a meeting, and these two things that are listed here, we did discuss at our last meeting. I'm not sure, Todd, what do we need to cover on the revision of the food service construction requirement guide?
Well, that was the last, if I recall, we were going to get the group back together. We have a food group that we've been working with to totally, to come back and start setting up some type of workshops, educational sessions, whatever you want to call it, regarding to going over that and showing all our successes and how we did all our improvements through this process.
Okay, so we still haven't done that.
We still haven't even done that, but the actual approval of that is set, and that's what we went through at the policy committee, is that guidebook.
Right.
And we will be bringing forward, just as we had approved a policy regarding, we were starting to look at the COVID-19 at the time regarding illness occurrences and all of that. We will be bringing kind of the adaptation of the county's policy to the next policy committee next month, Ron.
Are we meeting next month?
Yes, we will be meeting next month.
Virtual or in real?
Probably virtual, because gatherings of 10 or more will not be
Well,
permitted.
we don't have 10 on the policy committee.
I know, but again, we will be taking a look at that. We will wanting to make sure that our environment is, I think we'll probably move to doing more, for a couple of months being virtual until the group sizes are allowed in terms of the keeping in the rhythm on the open meetings.
Okay.
But we will also, yeah.
I'm just curious, how did we get past the Open Meetings Act?
It was an executive order from the governor.
Ah, okay. Like everything else.
Yes, but this was a good one. It really did allow, we wanted units of local government to move forward. And again, we'll be watching very carefully, as everyone knows, over the next couple of months as we bring groups together. And we'll be opening up our building a little bit more. Remember, the dental practice will start opening up. So again, you start having more COVID in the environment, I'm going to call it. And so I would not want you to be in that situation. So we'll maintain virtual for a while.
Will we continue to use something like the YouTube so that we really are open?
Yes. In fact, we have Dan's assistant. We're going to be publishing that out. That's why we're kind of working through this was our first go around. The county board has been using it as well to go on to the YouTube channel for the true open meetings. We will invite participants and guests. Again, they use the same process to let us know that they want to have time to speak at the meeting or, that kind of thing. So we want to make sure that we're maintaining that as we move forward. So we'll be getting our own Zoom account for, government business. And so we will continue this. This was, as I said, our first go around to see how it does with the bandwidth, with the number of people we have on it as well. So I'm thankful to all the staff that signed on for a while. I know this is not optimal in so many ways, but we kind of have to lead by example as well.
The other thing we have here is summer hours program update. You talked about that at the last meeting too. Right.
And obviously we're not in any summer hours mode at this point. Usually that would have gone into effect after the Memorial Day holidays. So at this point, our communication to the staff right now is we're going to not postpone summer, but certainly not implement summer hours, given the fact that we really do, our presence and coverage has been different. And again, how much people can travel and take time off, and still, even when we lift some of these things about the encouragement of people is to stay put as much as possible. So we'll want them to be staying put. So we'll encourage that. And again, we'll save it up for the next year to return to summer hours.
When do you want to schedule the policy committee? I have a tight schedule. I'm here 24/7. So.
Okay, well, I was thinking to myself, I know many of us are mind traveling now. So yeah, we have to figure out what's a good mind travel time. Typically policy committee has been, it follows or precedes finance committee. Is that still we had moved finance committee to 6 o'clock. to accommodate Dr. Halverson. Is that going to still work for you, Dr. Halverson?
Yes, that at this point, 6 or 6:30, I'm at a point, anything will work.
Which would everyone prefer? Because we moved it so because of the work schedule, but I don't, and hopefully you'll be resuming stuff up. So,
We are resuming, but my Wednesdays are still in flux, so yeah, whatever.
Okay.
If it's going to be by
So-
remote, I'm flexible. I just need to grab my phone or laptop and I'll be able to join.
Okay.
So we could stay with our 4:30 policy meeting time that we've had?
Yes.
Okay.
Is there any objection to that?
No, I don't think, not from me.
Not for
Okay.
me.
Second Wednesday, 4:30.
And then finance will then be at 6:30, I heard. Let me confirm that. And we're going to work with, Dan will have to teach me. I haven't done posting of documents while in conference on Zoom. So that's a little bit different than the Cisco, but to Ron's point, to make it a little more interactive, if we have documents we want to put up at the time, we can work on that as well.
Yeah.
So that it helps a little bit as we move through this.
Well, as much as I like seeing everybody in person, this sure is a lot easier for the commute.
Looks like personnel, no meeting, and quality, no meeting.
Yeah, no meeting.
And do we have any new business or other matters?
Just want to thank everybody for giving it a go and a try. I know that this is a challenge for everyone, and thanks to Christina for putting her first board packet. I've lost sight of where she's at. She has kind of learned, been baptized by fire, as we say. And so she will also be sending out meeting invites and reminders for the Zoom. So don't assume it's the same link, because as we get our own account, thanks to Dan and support from IT to help us get that rolling. And then these will be saved for posterity.
Well, thanks everyone for making it, and please be safe, wear your mask, your social distancing, and try your best to follow all the current guidelines.
We
Then we need
adjourn.
a motion to adjourn.
Move we adjourn.
Second.
Again, all in favor?
Aye.
Any opposed? Excellent. Be safe, everyone.
Yep. Good to see
Bye.
everybody.